Welcome to your teaching video regarding your upcoming liposuction surgery. Liposuction may be a small procedure or more extensive in multiple areas of your body. Oftentimes, it's combined with other procedures such as an abdominoplasty. Small areas we can sometimes do under local in the office, and larger areas are done in the operating room. Oftentimes, we'll also combine liposuction with a tissue tightening procedure called Renuvion or J-plasma. While liposuction is not a replacement for weight loss, it's great at addressing specific areas where you carry more fat than desirable. Anytime you lose volume, whether it's through weight loss or liposuction, you will develop tissue laxity. And there are different areas of your body where this is more significant, and from person to person, we all have different tissue characteristics. So some people may be more at risk. Oftentimes, we will add a separate procedure during the liposuction called Renuvion to help combat this. Liposuction can help to improve your overall silhouette, but there may be some smaller contour irregularities, and if you gain weight after body contouring surgery like this, you may see it more dramatically in areas that weren't treated. Before your pre-op appointment, if you were required to get clearance from a primary care or specialist because of other medical problems, please make sure that's in the work. Sometimes we need some lab work or possibly an EKG. You're already watching this video, which is great. Know that we have a separate medication guide video, and if you're having this procedure with others like an abdominoplasty or breast surgery or something else, be sure to watch those videos, and those restrictions and instructions are probably going to outweigh what you see here. That's what you'll need to follow. 2 weeks prior to surgery, it's important to stop all blood thinner medications and untested herbal supplements. Common over-the-counter blood thinners include aspirin, ibuprofen, fish oils, and vitamin E. Be sure to review your teaching material and create a question list so we can go over this with you at your pre-op appointment. Again, we do have a separate video that goes over the medications that will likely be prescribed. There are some over-the-counter medications like Tylenol we'd like you to have, and at your pre-op appointment, we will transmit the prescriptions to your pharmacy. Typically, these will include an anti-inflammatory, a muscle relaxant, a painkiller, and something to help prevent nausea. The night before surgery, it's important to understand what are called your NPO orders. And what that means is when's the last time you can safely eat or drink. Food and full liquids need to be stopped a full 8 hours prior to surgery. So to make things safe, we say don't eat anything after midnight. You can, however, continue to have clear liquids until 4 hours prior to surgery. Clear liquids include things like water, Gatorade, apple juice, tea, and sugar and honey is fine in that tea, black coffee, no milk or cream, and Jell-O as long as it doesn't have chunks in it. These can be taken up until 4 hours prior to surgery or 2 hours before you leave for the hospital. If you normally have coffee or tea every morning and that caffeine is part of your daily routine, it's a good idea to get a little in prior to surgery because patients oftentimes experience a caffeine withdrawal headache if they didn't get their regular dose. You can also start your Arnica Forte, which is the homeopathic medication that we give you at your pre-op appointment to help reduce bruising and speed your healing. You can take your first antibacterial shower. You should review the arrival time and place and also instructions with your caretaker. If you have someone helping you after surgery, it's important that they watch this video and also the medication video. You'll likely also get a phone call from me and possibly from your anesthesiologist. On the morning of surgery, take your second antibacterial shower and don't put any lotion on the surgical sites. It's also smart not to wear makeup into the hospital. Bring easy clothes that are easy to get in and out of, like maybe a hoodie and sweatpants. Bring your garments and have them sitting out for me in pre-op. All patients who are having a general anesthetic are required to have somebody stay with them their first night. You can sleep in any position that's comfortable, and I'll warn you that liposuction areas will drain quite a bit in the first couple of days. It looks a lot like dilute cranberry juice, so you really want to make sure you protect your linens and upholstery. Using a trash bag with a dark beach towel on top is a great way of protecting your linens. Most patients are able to shower as early as the next day, but if you want to wait a couple of days because you're sore, that's just fine. Make sure that when you take your first shower, you have somebody there with you. I always say, shower with a friend. You can get quite lightheaded when you take your garment off, so make position changes slowly. Sit before you stand, and stand before you get into a warm shower, because the warmth may make your blood pressure drop even more, and you could get lightheaded, and we certainly don't want you passing out. You remove the garment, all the pads underneath, and leave the little pieces of hypoallergenic tape on your incisions. Everything can get wet, and I'll warn you, you're pretty exhausted after this first shower, so make sure you don't have any eager plans right afterwards. These foam pads underneath your garment are called toppy foam. One side is sticky, and that's treated with silicone, and that's the side that goes against your skin. The goal of toppy foam is just to provide smoothness and also even pressure. So we like to use it under the zippers and across the top of the garment, especially if you're also using a surgery bra. Now, you don't have to use the toppy foam for a long time, but we would recommend continuing to use it to at least your first follow-up appointment. You can change to like a Spanx tank top or a camisole under your garment if you'd prefer to have some fresh cotton next to your skin. If you're sleeping and you feel like the tight garment is really distracting and making it harder to breathe, by all means unzip it and unhook it. Garments and foam can get a little bit gross, so you can lay around in your robe while you wash your garment, and you can even rinse off your toppy foam even though the blood stains on there won't go away. There aren't a lot of restrictions for liposuction, so if you are having other procedures, those restrictions will take precedence. Really, with liposuction, just let pain be your guide. What you can do comfortably, you should do. You absolutely don't want to lay in bed all day. Walk a lot and sleep in whatever position is most comfortable for you. It's normal to see drainage that may last for a couple of days. It's usually a dilute, bloody drainage. It's also normal for you to be sore. I like to describe the pain after liposuction as a pulled muscle and sunburn together. You'll probably also be pretty tired. You'll see a lot of bruising, and you may see more bruising in areas that are dependent, like the crotchless part of your garment may allow more to accumulate in the genitalia area, tailbone, and down in your legs. If you had Renuvion or J-plasma, you might also feel what's called subcutaneous emphysema, or the feeling of little Rice Krispies under your skin, and this is totally normal and nothing to worry about. You will carry a lot of extra water weight for the first week or so after surgery, and that's normal. You'll also be kind of itchy because of your garment, so it's nice to have those antihistamines around if that can make you more comfortable. A low-grade fever of 99 to 100 is not concerning, but if you're getting closer to 101, you need to let us know. It's also normal to have a lot of itching, but if you develop a rash that's spreading to other areas of your body, especially things that are not under the garment, that could be a sign of an allergic reaction to one of your medications. If that happens, stop all medications. Take an antihistamine, as we describe in the medication video, and give us a call. Also, a sudden onset of chest pain or shortness of breath can be a sign of a pulmonary embolus, and you absolutely need to let us know if you experience that. If you have persistent lower extremity pain that's a lot worse in one side than the other with swelling, that could be a sign of a blood clot. Now, most people do have quite a bit of swelling in their lower extremities after extensive liposuction, so this would be something that is significantly worse on one side than the other. It really depends how much surgery you had. For smaller areas of liposuction, you may be able to drive as early as the next day. For extensive liposuction, it may be closer to a week. We don't want you driving until you're off all of your narcotics and Valium for at least 12 hours. Use good judgment because typically when you're driving and sore, your reaction time is slow. At your first follow-up, which is usually about 4 to 5 days after your surgery, we'll look at your surgical sites to make sure everything looks like it's healing well, remove any itchy coverall, answer any medication and activity questions, and if you did buy some second stage garments to switch into, bring them so we can take a look and see if they are appropriate. Second stage garments are like Spanx, good quality elastic undergarments that travel both above and below the areas where you had liposuction that you can transition to. Early on, you'll appreciate the zippers and hooks, but as time goes by, you'll want something that's a little slimmer and works well under your clothes. The second follow-up may be a week later, or for some patients, even a couple of months later. This is when you can start your scar care, and we usually recommend biocorneum, which is just a little silicone with sunscreen that you can rub into your incisions. Compression is recommended to be continued for about 6 weeks after surgery. Tenderness and numbness may take months to resolve. It's a great idea for patients who are having body contouring surgery to continue to monitor their weight because your swelling will go down over time, and we just have to make sure that you aren't gaining weight during this period because you're just so happy with your physique. Congratulations, you are now prepared for your pre-op appointment. Having reviewed this material ahead of time will make you less nervous and better able to acquire new information. Please bring a list of questions to your pre-op appointment, and by all means encourage your caregivers to watch this video and also the medication guide video so they know what to expect after surgery as well. Take the time you need to heal. If you push it too much, you'll really not enjoy your recovery time. And please follow your instructions as best as possible to avoid complications during your healing phase.